So first off, I just want to thank you all for making it to this point and watching this video presentation. So this presentation is Squat School, and it's a sequence of exercise progressions to get everyone safely into a full range of motion squat, and then we'll provide evidence on why you should, by Cole Hyde and Alex Myers. So we want to start off with 3 key takeaways that we want you to get out of this presentation. And that's, again, a sequence of exercise progressions to get everyone working towards safely getting into a full range of motion squat, and then we'll provide evidence of why you should. So the 3 key takeaways that we want you to understand by the end is, number 1, why full range of motion squatting is a good thing. Number 2, how to use the 4 exercise sequence to get into a full range of motion squat. And then number 3, why you should be doing this for yourself as well as for your patients. As you can see with the pictures included, the end goal that we want to get to is a loaded full range of motion squat. And the pictures on the right kind of show the extremes, and that's heavy squats by the bodybuilder on the picture on the bottom, and then as well as an Olympic weightlifter. That is a very extreme version, but again, that just shows us what is possible. And then you also have a slant board goblet squat, which is also a great option for getting into that full range of motion. And this is the end goal because we believe that full range of motion squatting provides increased activation and strengthening of the muscles surrounding the knee joint, such as the quads, and even more so, the hamstrings and the glutes once you get into that full range of motion. This provides improved muscle balance around the knee, which therefore reduces muscle imbalances as well as potential knee injuries. And finally, we have improved muscle hypertrophy and athletic performance once you use that full range of motion. And we will provide research evidence at the end of this presentation. And according to this study, contrary to commonly voiced concern, deep squats do not contribute increased risk of injury to passive tissues. And we will go deeper into this study later on in the presentation. I thought that this would be a beneficial slide to go over, and that's real-world examples of deep squatting. So to start off, all of us as kids are able to effortlessly drop down into this deep squat. We believe it's a foundational human movement, and these kids, they sit in this bottom position for extended periods of time, and they don't have knee issues, they don't have back issues as a result. We just lose this ability as we get older because of modern chairs, not using this full range of motion during exercise, and not resting in this position like some cultures do, as you can see on the 2 pictures on the right. In some cultures, it's a very common way to eat or even just rest. And in addition to that, again, Olympic weightlifters, they're in this very deep squat position with heavy loads very, very often, and they don't have these traumatic knee injuries. An interesting note is that with the Olympic weightlifters, they don't suffer knee injuries more than the average person. It's just the knee injuries that they do have are actually just overuse injuries and tendinopathy issues, which is just a load management issue. And according to a study, the injuries typical of elite weightlifters are primarily overuse injuries, not traumatic injuries compromising joint integrity. These injury patterns and rates are similar to those reported for other sports and activities. So these Olympic weightlifters use a progressive weightlifting approach, which gradually exposes their tissues to new loads and allows them to recover properly, which is what we will go over in the exercise sequence that we are providing. So just going over a few points on why using a full range of motion squat is better than just a quarter or a half squat. And that's, on this first study, we found that training deep squats elicited favorable adaptations on knee extensor muscle size and function compared to training shallow squats. This shows there's actually increased hypertrophy when you use the muscle's full range, which has beneficial effects on quadriceps strength and muscle size. In addition to that, full range of motion squatting provides pressure and movement to bring synovial fluid and healing to the joint. So the tendons, ligaments, and the joint in general have anabolic processes, just as muscle tissue does. And when you use this combination of pressure and motion, that a full range of motion squat provides. You have increased synovial fluid to these tissues, and instead of avoiding a certain position, which causes atrophy and decaying of tissue, you progressively load this tissue, which will bring healing and resilience to the joint. As far as tendons goes, increased tension and compression will result in tendon thickening. And also, I think a good point to make is deep squatting has previously been thought of to be harmful for the ACL and PCL because of early research that suggested that allowing your knee to travel over your toes during a squat caused excessive stress and strain on these ligaments. However, further research has shown that not only is this not true, it also shows that deep squats may actually be protective for the knees. And athletes who regularly perform deep squats have demonstrated increased ACL and PCL thickness, which again just goes to show that these tissues have anabolic processes that full range of motion improves. And as an added bonus, moderate loading of knee cartilage has been shown to elicit improvements in cartilage volume. I think it's beneficial to at least discuss the correlation between the VMO and knee health. So there's much debate taking place regarding the topic of selective strengthening of the different components of the quadriceps muscle. And kind of the prevailing argument is that this can't be done and that strengthening of one part of the quad strengthens all parts of the quad. This would seem to be unfortunate because, as it turns out, when the VMO, or kind of that inner teardrop part of the quad, is weak, the vastus lateralis, or that outer part of the quad, can cause abnormally high pressures in the knee, resulting in increased knee pain. In addition to that, one of the primary research papers insisting on the inability to preferentially load the VMO only researched knee loading at joint angles of up to 90 degrees of knee bend. So in other words, no deep, full range of motion loading. Recent research appears to suggest that some very interesting things happen to the quads the deeper you squat. In the bottom range of a full range of motion, full depth squat, with about 140 degrees of knee flexion, the VMO is activated to a proportionately higher degree than the vastus lateralis. Additionally, there's research that shows that the larger volume your VMOs, the better your deep squat performance. So there's a correlation there. And that's why I included the two pictures on the right, which is Liu Xiaojun, who is a Chinese Olympic weightlifter. He's set many world records, and you can see the large VMOs that he has. In addition to that, Tom Platz, a bodybuilder, is known for his kind of world-class legs, and he has always been an active proponent of the full range of motion squat. I think the takeaway here is that it's probably beneficial to squat with a full range of motion to develop the vastus medialis muscle. Tendinopathy and hyaline cartilage. So this diagram shows tendinopathy perfectly. So tendons need load, not too much load to where the tendon can't withstand it, and not too little load to where the tendon starts to atrophy and weaken. Both too much load and too little load result in reactive tendinopathy, tendon disrepair, and degenerative tendinopathy. However, when you find that sweet spot and you have an optimized load, a stimulus is imposed on the tendon, which therefore adapts and strengthens. This is where the proper progression of exercise is so essential. It is vitally important to find the right amount of tension and load on the tendon by choosing the proper exercise at the right intensity. And so for tendinopathy, this is mainly guided by pain. This is done by gradually exposing the patient to tendon loading and progressively overloading in a pain-free range, which will result in improvement in the symptoms of tendinopathy over time. So basically, with tendinopathy, we want to find where they're at and gradually, progressively overload to improve their tendon resilience. And again, with our sequence, we're providing a simple and effective exercise progression, which does just that. It progressively overloads the tendon in a pain-free range, always with pain guiding the progression and always keeping the focus on gradually improving your own ability. And squatting with a full range of motion could potentially be an effective exercise to improve tendon health even more due to the positive tensile stress throughout the full tendon range of motion. So by performing full range of motion squats, the quadricep muscles are fully engaged, which helps to strengthen the muscles around the knee joint. This increased strength helps to distribute the load more evenly across the joint, reducing the stress placed on the patellar tendon and allowing for safer tendons in the future. So we also know that eccentric training is very beneficial and is kind of the gold standard for tendinopathy. And this is where also the power of the progression that we're providing, or the sequence that we're providing, in that you can kind of slow the tempo down for each exercise and have more of an eccentric tempo for each one. And that just comes down to kind of the skill of the clinician providing this sequence. And one study that I just wanted to include by Bontemps et al., and that's a short bout of eccentric downhill running training can significantly increase the stiffness of the patellar tendon and strength and size of surrounding musculature, similar to resistance training. So this study further demonstrates that tendons need load and respond favorably to load. So downhill running is a similar stimulus to reverse step-ups. If you were to kind of compare the running downhill versus a reverse step-up, it's a very similar motion and a very similar eccentric contraction. And that's why this reverse step-up, which is the second exercise in the 4-exercise sequence, works out very well for tendon health. The length tension curve of the muscle explains the concept of short range and long range very well. So active tension can be thought of as when the tension is on the muscle. Passive tension can be thought of as when the tension is on the connective tissue. A short range exercise is when the majority of the movement utilizes active tension, while a long range exercise is when the majority of the movement uses passive tension. So following this, it can be stated that a short range exercise is more muscle dominant, while a long range exercise is more connective tissue dominant. So this concept applies to every single exercise for every joint of the body. There's no exercise that's 100% short range, and there's no exercise that is 100% long range. Rather, every exercise falls along a continuum of both. So for example, in regards to knee extension, which works the quadricep muscle, a short range exercise where it is muscle dominant would be a reverse step up. So, and that's the photo on the left. This is a short range exercise because the knee is only going through its top range of motion and the quadriceps is not being stretched. So the muscle is basically doing all the work and there's no tension or stress on the connective tissue. Not as much as with, say, a full squat. And again, on the other end of the spectrum, a full range of motion back squat would be considered a long range exercise because it is connective tissue dominant, because the muscle quadriceps is being maximally stretched while under load, which places stress on the connective tissue as well as on the muscle. And that's, as you can see with the photo on the right. So short range movements often feel like the muscle is cramping, while long range movements feel like the muscle is tearing, or like you can feel it really stretching. So it's stretching under load. So put simply, a short range muscle is contracted under load. A long range exercise is where the muscle is being lengthened under load. So another, I guess, a cool example of primarily a short range exercise is pushing and pulling like a sled, because that's strictly concentric movements. It's interesting, there's no eccentric contractions with sleds, so the muscle is basically doing all of the work. And so that's a great exercise to start to warm up with, because the muscles are doing the work, you're bringing tons of healing and blood flow to the area, and that will actually prepare you better for these long range exercises. Full range squatting and meniscus health. So full range of motion plays a crucial role in maintaining optimal meniscus health. So the meniscus, a cartilage structure found in the knee joint, acts as a shock absorber and provides stability during movement. Menisci and cartilage, ligaments, and bones are susceptible to anabolic metabolic processes and functional structural adaptations in response to increased activity and mechanical influences. Menisci require load to heal and strengthen. In addition, it has been found in numerous studies that menisci respond very well to exercise for recovering from a tear. According to this quote, interestingly, exercise therapy was as effective after a 2-year follow-up period and was superior in the short term for thigh muscle strength. The results of the study build on those from the smaller study mentioned earlier. In that study, both groups received instruction for the same graduated exercise plan. The researchers found that exercise was comparable to surgery for meniscal tears in patients with no osteoarthritis. So to add to that, a meta-analysis concluded that there was no statistical difference in clinical outcomes such as relief in knee pain and improved knee function between arthroscopic meniscus knee surgery and conservative management for degenerative meniscal tears. As this research demonstrates, exercise is effective for the health and recovery from meniscus health, from meniscal tears. Full range of motion squats are even more effective for the health and recovery of menisci due to the lubrication of synovial fluid from that combination of pressure and motion that we discussed earlier throughout the knee joint that can occur. So a graded approach of reverse sled, reverse step-ups, full range of motion split squats, and full range of motion squats are a perfect approach to begin gradually loading the knee joint and supplying it with the load, motion, and pressure that the connective tissue of the knee joint require. So the first step in the 4-exercise sequence to getting into a full range of motion back squat is backwards walking or backwards sled pulls. And this is the first exercise because this is a short range movement, not a lot of stress and tension on the connective tissue. It's just a lot of concentric movements that are going to begin to bring healing and blood flow to the knee joint. This is high reps, little muscle and tendon ligament damage due to no eccentric contraction. You'll find that if you can use a sled hard and you can go until you get like a 10 out of 10 pump, and you actually won't be sore from this exercise. It basically speeds up the healing and it's tons of blood flow circulation. So this is the lowest and safest level of knee loading, and that's why it's the first exercise. Like, it's not going to do any damage, it's just going to increase the healing and allow you to get into more difficult exercises, which we will show next. Second exercise in the 4-exercise sequence to get into a full range of motion squat is the reverse step up. And this can either be a Patrick, Poliquin, or Peterson step up. They're all very similar motions on the knee, except the Patrick is just done with a flat foot, Poliquin is heel elevated, and Peterson is heel elevated, but you don't have a wedge or anything under your foot. Like, you're just balancing on the ball of the foot. So this exercise begins to load the knee tendons and ligaments. It's very good for the patellar tendon. And how you progress this exercise, you want to start in a pain-free range always, and it's good to start with no load and no elevation. So you're just gradually beginning to load that knee joint. After that, you want to progress height until you get to 6 inches. And then once you get to 6 inches and you're doing that in a pain-free range, then you can begin to add load. For the third exercise to get into a full range of motion squat, we have the full range of motion split squat. And this is going to begin to work that full range of motion in the knee, but we're going to do it one side at a time. So this is going to build structural balance between legs. You or your patients might notice that you have a lot of imbalances between sides, and this is going to help even out before you get into that full range of motion squat. This is a great exercise for increasing ankle mobility because you're driving that knee forward over the foot, as well as the back flexion mobility because of the deep hip extension that you're getting into. And how you want to progress this exercise, you want to start on a very, very high box or even a chair or something like that in body weight, and you're just gradually working that range of motion. You can even hold on to a wall or a squat rack or something to even assist you and make it actually lighter than body weight. And then the next progression with that would be lowering the box all the way until you get to flat ground. Once you can do that, then you can add load. And if you can do this exercise with load and pain-free range, then you are ready for the full range of motion back squat. The fourth and final exercise is the full range of motion squat. And again, this can be just a body weight squat, a goblet squat with a dumbbell or kettlebell in front, a back squat, or a front squat. And the whole goal is to basically get both of your legs in that full knee flexion range of motion, and we begin to load that position. And this exercise provides a lot of benefits, which we have gone over throughout this entire presentation. And having the ability to do this exercise with load, pain-free, it's very, very beneficial for your knee health.
Now, I want to go over the mobility aspect and why is it essential to efficiently perform the deep squat. First off, why is it important? Well, with increased mobility, we can actually increase stability and adaptation due to the exercise. This will then lead to a more optimization of increasing strength and muscle size as well. Another reason is to avoid compensation. Sometimes we have weaknesses and restrictions at certain parts of our body at which our muscles will activate unnecessarily to help perform the exercise. This will then lead to an increased risk of injury. And that's where our last reason comes into play, is that we want to decrease the risk of injury. With greater range of motion along the joints, we're able to perform many activities and stay in certain positions without any problematic symptoms. Now, when it comes to the deep squat, we need to understand the biomechanics and how to perform it correctly. The deep squat requires a large amount of ankle dorsiflexion, knee flexion, and hip flexion with trunk mobility. We want, as you can see the picture on the right, this is me performing the squat with trunk upright as possible with great amount of dorsiflexion, knee flexion, and hip flexion as well. We also want to make sure that the lumbar spine is neutral while performing the deep squat. When it comes to sex, there are differences between the two when it comes to squat mechanics. Since females have a wider hip structure than males, they may need to widen their foot stance and lean forward more to obtain an optimal squat. The opposite goes for males, where they may need a more upright position due to more mass in the upper body and a narrow stance. One study has shown the differences of squat mechanics between the two, and that hip flexion range of motion was significantly associated with squat depth in male subjects, and ankle dorsiflexion with an extended knee and dorsiflexor strength were associated with squat depth in female subjects. While there are differences between the sex, it is solely based on the individual's preference and structure, since everyone has their own slight, unique body structures. Here are a set of mobility exercises that are quick to perform before starting your usual workout routine. The knee to wall and forward lunge seem very similar, but the knee to wall exercises solely focuses on ankle dorsiflexion strength and range of motion, while the forward lunge focuses more on the hip flexors. The pelvic tilts and the ankle circles both can be done at sitting or standing, but is solely based on your preference. Here's another set of mobility exercises. These sets tend to focus more on hip mobility as we need it to achieve greater squat depth. As you can see, there tends to be a lot of hip internal rotation with these exercises. A study has shown that adequate amount of hip internal rotation can help achieve greater squat depth. The hip circles indicate performing all planes of range of motion, such as hip flexion, external rotation, internal rotation, and extension, which will greatly help overall hip mobility. Overall, these mobility exercises are great to help mobilize the lower extremity and achieve the deep squat without symptomatic problems.